Hey mama, you're listening to Coach the Mother, where postpartum recovery gets real, raw, and deeply rooted in who we are. I'm Dr. Natalie Forsell. I'm a virtual pelvic floor PT, postpartum fitness expert, and mama who's walked through grief, healing, and the long road back to herself. Around here, we are rewriting the outdated narratives about birth and the body. We're demystifying healing, reclaiming strength, and giving modern moms the wisdom they should have been given from the start. Let's coach the mother. Over the next several episodes, I am going to start to unpack some really common questions I get from moms in my DMs, in my clinical experience, in my virtual coaching space. So I figured if other moms are asking these questions, you might be too. The first one that I want to talk about is, I get this all the time: how soon can I start to exercise after giving birth? And I think before I can answer that question, I would like to ask you, as you're sitting here listening, when you think of exercise, what comes to mind? Are you thinking about how you used to exercise before you had a baby? Are you thinking about something low level, like going on walks, doing some core workouts? Or are you thinking about cycling on your Peloton or in a spin class? Are you thinking about getting back to Pilates or getting back to any type of activity that you used to enjoy before having this baby? Whatever type of exercise you're thinking in your mind really changes the answer to this question, because it depends. What is really confusing about this question for so many moms is how they get to their postpartum checkup. You probably only had one, but if you remember going to your 6-week checkup and they say, everything looks good, you're cleared for sex and exercise, and you're like, what does that mean? Or maybe you even ask this to your doctor and you've asked, well, how soon can I start exercise? And they say, you can start tomorrow. And then you think about what it is you want to do, and you're like, how in the world am I going to go on a jog tomorrow? I feel like my vagina is falling out, or my hips feel so wobbly, like they're going to fall apart. I think this question is very valid for moms and really frustrating for me as a provider, because oftentimes I ask these questions to the mom. What do you think exercise means to you? Did you talk to your doctor? What did they say? And all of the ridiculous things I've heard moms tell me their OBs have said to them really just make my blood boil. But the point of the 6-week checkup is a medical checkbox for insurance systems and for discharging you as a patient from an OB provider, but it is absolutely not clearance for anything. I can totally understand why so many moms feel confused about where to start. And this also applies to me. I remember, I mentioned this briefly in the last podcast episode, but I remember being 6 weeks postpartum with my first baby girl and having been pretty active throughout her pregnancy up until my 3rd trimester. I was excited to move my body again because it always has been a huge source of stress relief for me, and it helps me manage my internal space, my emotional space, feeling progressively limited in how I could use my body throughout my pregnancy and definitely postpartum really had a big impact on my mental health. I was really craving to get back to movement for a variety of things, to feel stronger, but also to help manage my anxiety and manage my mood, because that always has been my biggest arsenal in my tool belt of self-care. Asking this question to my OB was pretty pointless. They said, whenever you feel like it, you're cleared, everything looks good. And then I thought to myself, I don't feel good. I don't feel okay. The farther I got from that 6-week checkup, the more glaring some of my own problems seemed to be. My leaking wasn't going away. I was having really weird leg numbness down my left thigh that I couldn't explain. I felt like I had ab separation and my core felt so weak. Everything felt so difficult. I remember feeling so surprised with how challenging very simple movements felt: getting in and out of bed, getting in and out of a chair, up and down off of the toilet, up and down off of the ground. I was like, there really is nothing happening in this middle part of my body, and I don't know how to make that better. I think it's one thing in my clinical journey to help other moms through their own stuff because I could see it with an unbiased lens. But for whatever reason, when it was happening in my body, all I knew was I had this sense of this is not good. I know that. And I'm privileged to know that there's so much that can be done about it. But I had a really hard time kind of identifying and troubleshooting my own problems because I just had what every mom has at that phase. You're in this newborn phase, you're super sleep deprived, super emotional. I had little to no capacity to use my own clinical brain on my own body. And so I needed support and I needed help. And it was almost impossible to find, even though I am in this field myself. I remember feeling really confused as well with my previous history of activity level, feeling like I shouldn't need to start with breath work on the ground. I was really active. I feel like I look, air quotes, fine. I lost my baby weight pretty quickly after that birth. And I was excited after the 6-week point, just try a little workout from at the time I was using Nike Training Club. It's a free app. I get in and I do body weight exercise, and immediately I'm just stunned by how challenging it felt and how even what felt like simple movements of a standing squat with my feet wide or a lunge position, it felt really hard to find a way to move that didn't hurt. All of it was kind of creating this sharp pain in my pelvis, or I felt like I just couldn't feel my muscles turn on. And I'm like, I thought this was the easy stuff, the lowest level stuff I could do for myself. But that was not the case at all. I was a culprit of this exact same mentality where I was thinking about what exercise meant before I had babies. This experience of mine really opened my eyes and changed the way I practiced in general and practiced with moms. And now I say this so often to my coaching clients online that anytime there's a big transition in your life, we have to reorient what it means to take care of ourselves, and we have to find a new uncharted path forward. Between 0 to 1 kids, what are some things that help you take care of yourself? Maybe before babies, you had a 20-minute long skincare routine and you like to read a bed with tea at night, and then now you became a mom. You can't do any of those things. We can mourn or grieve the ways that we used to know our bodies and know how to take care of our bodies, and then feel like we're always trying to look back and measure up what we're doing now with how we used to do it in the past. And this is very true for exercise. We don't know what we don't know, especially if you have no idea what pelvic floor PT is or have very little understanding of it. So you're comparing what you hope or want to be doing in your body with what you used to be able to do. And every time we come to this type of transition, we have to chart a new path forward to find what it means to move, how to start from a brand new place that feels unfamiliar to us. This happens after every single baby. If you've had 1, 2, 3, 5, 12 kids, the ways you used to take care of yourself can almost never align with who you are now as a mom, what your family needs of you, and what that looks like. And I just want to name that. The question is, how soon can I start to exercise? And I'm trying to paint a picture for you here that we need to let go of expectations. Maybe that's the biggest thing you'll learn out of this episode today, of how to release any previous expectations, whether they're conscious and you can name them, or maybe you need to sit and reflect on what is making you feel so stuck or why this question maybe is so troubling to you. Because maybe what you perceive exercise to be needs to change for a little bit, and it might be really unfamiliar and foreign to you. That's more of the mindset behind this question. I want to give you very specific, tangible, actionable things that I can teach you about how soon you can start to exercise after birth. There are lots of different philosophies out there around postpartum recovery in general, and I can get more into those in another episode. But one super popular one at this moment is the 5 rule, where you are in the bed for 5 days, on the bed for 5 days, around the bed for 5 days. That is a practice around slowness, being able to really attach and attune to your baby, give yourself a lot of rest. If that is something that feels really necessary and helpful to you, by all means. There's so many ways to birth and ways to recover from birth. If you listen to my last podcast episode, we talked a little bit about how quickly our muscles can decondition from lack of activity, from bed rest, or from just changing our activity level. The more time we spend doing nothing at all, the more we can start to feel and experience that loss of strength in our bodies. But we also balance that with our bodies are healing. We are still bleeding. Our pelvis just expelled a big baby, or maybe you had a C-section birth and you have real wound healing that needs to happen from all of those layers that they cut through. Rest is so valuable and important, but we spent the first part of this episode debunking what we think exercise means, because when I think of exercise now, through all of my childbearing, through my clinical experience, exercise is any type of healing movement that has a goal. That's what I like to think about exercise. When I think about exercise postpartum, sometimes moms can feel really thrown off when I say, you can start day one. And they're like, what do you mean? What possibly could I do in that first day after I gave birth? I'd love for you, if you haven't already, to check out that previous episode about the postpartum recovery timeline. So helpful. Drawing from that, this first most foundational and crucial part of your postpartum recovery is simple breath work and tissue mobility. I will call that exercise. If you are doing anything for healing or an intentional goal, that makes me think exercise. If you start right after birth the next day doing some diaphragmatic or 360 breathing, you do 2 to 3 minutes of that 4 to 5 times a day. That's exercise. That is getting your whole breathing mechanics to re-engage. That's getting your core to re-engage. If you feel you could do simple low-level activities like glute sets, or essentially squeezing your butt cheeks. You're laying in bed, you have been in bed and you want to stay in bed for a few days, but you want your muscles to activate and turn on. So you just squeeze your booty cheeks and squeeze your quads for 5 seconds, let it go. You do that 10 times and you do that multiple times a day. That's exercise to me. Starting walking postpartum is also not something that I want moms to be afraid of. Doesn't mean that you need to go from giving birth yesterday to walking 20 minutes the next day, but getting up on your feet and giving your circulatory system some ability to pump and get your heart rate up a little bit. If that starts with 3 to 5 minutes in the first week, 5 to 10 minutes in the second week, whatever it is, just increasing your walking tolerance throughout the first few weeks of postpartum, that's exercise to me. There's evidence around how healing it can be to do some of these super gentle movements, super gentle exercises from the earliest days postpartum that actually help with tissue healing and recovery. Overall, my answer of how soon can I start to exercise would be we need to redefine what exercise looks like in earlier postpartum. B, you can start as early as day one, but you need to know exactly how to progress and how to do it well, and what signs to watch out for that can tell you you've gone too far, you pushed your body too far. We don't want to push our fragile bodies too far too quickly early on, but if we just sit in this space postpartum and we do next to nothing because we don't know how to progress, we're scared we're going to hurt ourselves, or we're scared we're going to make any symptoms we have worse, then all we're doing is letting our body continue to decondition without giving it the fighting chance it deserves to heal well. Inside my postpartum recovery program, I have built a whole 4-phase recovery system around my clinical experience, around research, to help rebuild your body from the ground up after you give birth. Whatever symptoms you might be experiencing, we customize a toolkit to help you heal what hurts and what needs attention. Or if you don't really have any symptoms at all, but you just want to regain your strength and do that gradually and appropriately so you don't get hurt, that you can do it all from home without having to DIY it through YouTube and Instagram. If you want support and guidance on how to reclaim what it means to take care of yourself and how to feel strong and confident in your body, this program would be perfect for you. All the information for this postpartum recovery program is in my website below. That should have everything you need to know. If you still have questions about your specific journey and what type of support you're looking for, you can always DM me on Instagram at Dr. Natalie Forsell. This postpartum recovery program has limited spots available per month. So if you think this would be a great fit for you, I would love for you to apply to the postpartum recovery program from my website, and we'll get in touch about next steps. Thank you for joining me on Coach the Mother. I can't wait to chat next week.